Greetings and welcome to the second video in our December series, Being Intentional About Depression. I am Reverend Dr. Shalita Mira, psychologist, licensed clinical social worker, and senior pastor. And this month of December, we are focusing on our heart-centered wellness by equipping communities with wellness strategies for the mind, body, and spirit. So it is my prayer that you will journey with me as we continue discussing the topic of depression, in addition to identifying coping strategies for healing during this season. Rupi Kaur, poet, says, "Depression is silent and you never hear it coming, and suddenly it's the loudest voice in your head." Rupi Kaur also describes depression this way: "Yesterday, when I woke up, the sun fell to the ground and rolled away. Flowers beheaded themselves. And all that's left alive here is me, and I barely feel like living. Depression is a shadow living inside of me." So let's talk about it. We have normalized depression and accepted it as a normal part of living when it's not. We carry our grief and sadness, and we refuse to release it because somewhere along the way, someone told us that we were destined to carry this burden. But we have to begin to talk about it. We have to begin to release it. We have to begin to seek treatment for it so that we can live healthy, whole, and healed lives. So listen to these stats for a moment. 63% of African Americans believe that depression is a personal weakness. Let that sink in. Only 31% of African Americans believe that depression was a health problem. And African Americans were more likely to believe that depression was normal than the overall survey average, meaning that 56% believed that depression was a normal part of aging. 45% of African Americans believed it was normal for a mother to feel depressed for at least 2 weeks after giving birth. And 40% believed that it was normal for a husband or wife to feel depressed for more than a year after the death of a spouse. And again, while when we think in isolation, there is going to be some sadness, there's going to be some depressive symptoms that may be attached to the aging process. What I want you to understand is depression should not be normalized when it is significantly impacting our lives. Unfortunately, many in our communities are struggling and suffering with depression in silence. And here's why, according to statistics. 40% of African Americans deny that they even have depressive symptomology. And this could also be connected to, and one of the reasons why we are focusing on this particular topic so that our community can become smarter when it comes to our own mental wellness, but it may be a lack of education and educational gap, not knowing the symptoms of depression, not knowing that if I've struggled with this for 3 weeks, that it may signify something more intense that needs to be addressed, right? So denial, 40%. 38% of African Americans see having depression or any other mental illness as an embarrassment. So there's shame attached to it. 31% of our community do not want help or refuse help. 29%, there is a disparity when it comes to money and insurance. So there's a health disparity specific to finances and resources to get the help that is needed. 17% of individuals in our community fear depression. Another 17% lack the knowledge of the treatment or problem, which we kind of talked about a little bit earlier in the denial category. 12% just feel hopeless. There's no motivation to learn about it, do anything about it, just feeling this present state of hopelessness, feeling trapped in hopelessness. And African Americans are less likely to take an antidepressant for treatment of depression, and only 34% would take it if it were prescribed by a doctor. And that kind of goes back to the perception of mental illness, depression, anxiety, any other mental illness as the stigma that we associate with it, that there's shame attached to it. And we have to begin to shift and change these narratives. Not everyone who suffers with depression needs medication antidepressants. However, there are some who do need medicinal support via an antidepressant, but it has to be the right antidepressant, which means you want to work with your therapist in tandem with your medical provider, in tandem with your psychiatrist, in tandem with prayer and revelation from Almighty God to know if medication is right for you and which medication is right for you. Because remember, there are some biological foundations, there are some biological etiologies that can manifest, right, or trigger the onset of depressive symptomology. And we're going to talk about that a little bit more as we kind of process through this little educational series. We're going to talk about some of those biological diagnoses that can lead to depression. And I really want to remind you that depression, again, is not just in our middle age and older age population, but major depression strikes 8% of youth ages 12 and older. So our children are experiencing the symptoms of depression. More girls than boys and adolescents experience depression according to statistics. But there are equal rates when we talk about childhood manifestation. And the research points to 3 factors that have been precipitating factors or triggering factors for depression. And one is the environment. So experiencing what we call adverse childhood experiences, which can be abuse, neglect. We see divorce there's divorce in the home, homelessness. There are some others, but those just give you some examples of those adverse childhood experiences. Temperament, so the normal temperament of the child, which can sometimes be connected to biology, but it can sometimes be connected to how we're raised and worldview, and then also genetics. So an individual is 2 to 4 times more likely to have depression if a first-degree relative was diagnosed with depression. So there are some risk factors that we need to also pay attention to when it comes to our children. Here's another poetic piece just to help you conceptualize the manifestation of depression. You have no friends. No one could understand. You deserve to feel this. By relating to others who feel this, you welcome it and only have yourself to blame. When someone equates theirs to yours, they're just trying to feel less alone. They don't want to help. They want to trap you here forever. This poetic piece really kind of helps us or gives us a glimpse into some of the negative self-talk that comes along with the symptoms of depression. A lot of times when we hear depression, I've also heard stigmatic phrases in response that allude to the individual being lazy. They're just lazy. They don't want to do it. They just need to pull themselves up by the bootstraps, not understanding how paralyzing depression can be. And when one has heard those types of phrases all their life, associated with those who may be experiencing some significant sadness or grief or depression, they tend to be in a space of denial when it comes to the depressive symptoms, but then there's also a lot of negative self-talk. The person does not want to share their struggles because of all of the stigma they've heard in the past. And so they're stuck in this space alone, processing and running all of these different responses in their mind. And what happens is they become so overwhelmed that they withdraw, they retreat because they feel trapped. And then you have the hopelessness attaching itself to feeling trapped, making an individual feel like this is never going to go away. I'm going to be in this state of sadness. I'm going to be in this dark hole forever. As we become more knowledgeable about depression, what it looks like, how the symptoms manifest, prayerfully we will be able to identify it in others and provide the appropriate supports to them so that we can help them. We can help pull them out of this space of darkness, help speak life into them so that they realize that this is just a moment. There are healthy ways to respond to it, and they are not alone.